All right, now 3.3 million girls aged 10 to 14 years have received the first dose of the Human Papillomavirus Vaccine, with 2.3 million receiving the second dose. The vaccine was introduced in the country back in 2019.
Health experts say cervical cancer is still a threat, ranked as the #1 cause of death among women, with 10 deaths reported daily. The Ministry of Health says collaboration is needed to vaccinate over 90% of girls by 2030.
Cervical cancer, a disease caused by the human papillomavirus HPV, is still a threat in Kenya. For instance, 5,845 new cases and 3,591 deaths were reported in 2022. The Ministry of Health says 10 women succumb daily. Globally, cervical cancer is the fourth most common cancer, with 604,000 new cases and 342,000 deaths recorded annually. In a bid to reduce the cases, the Kenyan government introduced HPV vaccines in 2019. The vaccine is administered in 2 doses. While some counties like Kisumu, Migori, Kajiado and Kakamega have made strides with the uptake, others, among them Wajir and Mandera, are still grappling with cultural barriers.
We have also some issues with the geographical disparities. That is an uneven distribution of vaccination success, with some counties achieving high coverage while others lag behind. We have access barriers. So that is limited vaccine accessibility in remote and marginalized areas.
During a media engagement on Friday to mark Cervical Cancer Awareness Month, Head of Cancer Control Program Dr. Joanne Paula Bor urged women aged 25 to 49 years to go for cancer screening.
In secondary prevention now, this is the stage where one may be having HPV infection and their cells are starting to change into pre-cancer cells or even cancer cells. So that is where we are looking at screening, and we are advocating it for women 25 to 49 years.
National screening guidelines recommend a screening interval of 3 to 5 years for HIV-negative women and 1 to 3 years for women living with HIV. Board says early screening could reduce the burden of the disease.
Early detection significantly improves outcomes and remains a cornerstone of our prevention efforts.
As partners and as the government, we support to strengthen the health systems so that people can easily access these services that we are talking about.
Millicent Kagonga, a cervical cancer survivor who was diagnosed with the disease in 2015 when she was 25 years old, cited stigma as a challenge.
I went to the first facility for me to do the cervical cancer screening, but I was told I'm too young to have cervical cancer. So they gave me antibiotics. I used the antibiotics, but nothing happened until when I went to another facility and insisted for the cervical cancer screening. That's when I was diagnosed with cervical cancer advanced stage.
The World Health Organization targets to fully vaccinate 90% of girls, screen 70% of women and treat 90% of women diagnosed with cervical disease by 2030. Kenya hopes to be cervical cancer free in the next 100 years. Kasichana Masha, Easy Friday.